Pneumonia is a varying type of lung infection that has several types. The severity depends on the type of pneumonia, the age of the person infected, and whether or not the person has immune deficiency. The most common types of pneumonia are bacterial, viral, and aspiration. Bacterial pneumonia is most commonly caused by Streptococcus. It affects all ages and can be very severe. The bacteria will reproduce in the lungs, and the body will attempt to fight off the foreign bacteria. This causes inflammations of the alveoli, also known as air sacs, causing them to be filled with fluid. This greatly affects the intakes of oxygen and the removal of carbon dioxide from the lungs. Viral pneumonia is most commonly seen in children, however can be seen in anybody, and according to the World Health Organization, it is the leading cause of death in children worldwide, and it kills an estimated 1.4 million children under the age of 5 every year. The causes are generally a disease previous, such as the chickenpox or the flu. Aspiration pneumonia is most commonly seen in the elderly. It is caused by inhaling foreign substances, such as liquid or food. According to Healthline.com, symptoms for pneumonia are typically the same. For bacterial pneumonia, symptoms include high fever and shaky chills, cough, chest pain, which is usually worse when breathing or coughing, shortness of breath. For viral pneumonia, symptoms include cough, fever, headache, muscle pain, fatigue, shortness of breath, constant fever of 102, sweaty, shaky chills, and blueness of lips. For aspiration pneumonia, symptoms include chest pain, shortness of breath, wheezing, fatigue, blue discoloration of skin, cough, difficulty swallowing, and bad breath. The effects of pneumonia is shockingly devastating. The pneumonia is a great risk to children, elderly, and people with immune deficiencies such as HIV, and can be a fatal threat. It kills millions every year from all ages and all types of health. Ultimately, pneumonia can cause respiratory failure, sepsis, which can lead to organ failure, acute respiratory distress syndrome, and lung abscesses, which all could lead to death. According to the CDC, globally, pneumonia kills 1 million children under the age of 5 every year. This is greater than the number of deaths from any infectious disease, such as HIV infection, malaria, and tuberculosis. In healthy adults that contract pneumonia, it does not hold a great threat. However, it still needs to be treated and monitored. The most serious threat that pneumonia poses on is people that lack the immune system to fight off the pneumonia. When a patient has a weak immune system, the infection often becomes uncontrollable even with intense treatment. For example, people do not die of AIDS, they die of simple diseases, commonly pneumonia, because they contract this infection and their body just cannot fight it off. According to Healthline.com, treatment can vary depending on the type and severity. Generally, bacterial pneumonia is treated with antibiotics, while also taking an anti-fever over-the-counter medication, such as Tylenol. However, viral pneumonia is treated with an antiviral medication, because antibiotics are not effective against the virus. Aspiration pneumonia is generally more serious, commonly treated in the hospital, and most likely treated with antibiotics as well. In healthy people, pneumonia could possibly be treated at home with rest, plenty of water, cough and cold, and fever medication.